Okay, so in Module 8, Lesson 3, we're going to talk about health insurance. So, what is health insurance? A type of insurance coverage that covers the cost of an insured individual's medical and surgical expenses. To better understand your healthcare plan and coverage options, you should understand these following terms. First of all, let's start with the premium. The amount paid by you or your employer in exchange for insurance coverage. Every plan will have a monthly premium. Now, you may pay weekly or bi-weekly, just depends on how you get paid. When you have group insurance through work, your employee will typically pay a portion, so they'll pay half of it maybe, of the premium. The portion you pay is taken out of your paycheck each pay period. The deductible is the amount you must pay each year to cover your medical expenses before your insurance plan starts paying them. A low deductible means a higher premium, and a high deductible is equal to a lower premium. A copay is a way of sharing with your insurance company the medical costs. You pay a flat fee every time you receive medical services. So you go to the doctor, pay a $20 copay. Ooh, look at that. I'm off the paper. I'm so sorry. Coinsurance is the amount you're required to pay for medical care in certain types of health plans after your deductible has been met. If you use a doctor or hospital that is not in your network, the portion of the bill you have to pay will be higher. So some covered expenses and exclusions. It's important to determine if a service or procedure you want are covered when you're choosing a health plan, because covered services vary from one plan to the other. Like a tattoo removal might or might not be covered, just depends. You better check before you think you're going to go into the dermatologist and get a tattoo removed on your insurance. All right, so what types of plans are there? Well, there are several different types of health insurance plans available, but the three we're going to talk about today are HMO, PPO, and HSA. So, HMO is a health maintenance organization. Typically, there is no deductible, but there is a copay. You're usually limited to seeking care from within your plan's network of providers. So if that doctor you want to see about that tattoo removal is not in your network, your HMO is probably not going to cover it. And generally the most affordable, this is generally the most affordable type of health insurance because of the limitations on where you can seek care. So what that means is you may have to travel to Little Rock to see some specialists because they may only have one dermatologist in their network, or two, one in Little Rock, one in Northwest Arkansas or something, and within the state. Okay, so PPO is a preferred, misspelled that, should be one F and two R's. A preferred provider organization. They negotiate discounts with doctors, hospitals, labs, and other providers. So a physician in this network usually only requires a copay. A physician outside the network may require some co-insurance, or you to make payment on the part that your insurance isn't going to cover before they do anything for you. PPO deductibles vary with the premium. An HSA is a health savings account. Savings accounts there are savings accounts that allow you to save money to pay for current and future medical expenses on a tax-free basis. Good options for individuals with high deductibles. Health savings accounts can pay for expenses your regular health plan doesn't cover, such as eyeglasses and hearing aids if you need them. While the money is in the account, it can be invested, and the investment gains are tax-free as long as they're used for qualified medical expenses. So the real cost of healthcare says many of us don't know the real cost of healthcare, and that's true. So you get in a situation where you've got a loved one who's sick and you're having to figure out how to shuffle around and get here, get there, and pay for medicine, you don't understand what it costs. So in healthcare, the word transparency refers to having access to the pricing information. So if you don't have insurance and you need to go to the doctor, it's well within your right to ask them up front what that's going to cost you before you decide to go there. And if you don't like that, you go somewhere else if you need to. Okay, that was the end of 8.3. Have a great day.